Let me ask you something, and I want you to really think about it before you answer. Have you ever walked into a room and forgotten why you went in there? Sure you have. Everybody has. That's not what we're talking about today. That's normal. That's just a busy brain juggling too many tabs at once. But what I'm about to show you today is different. What I'm about to show you today are 7 warning signs that your body and your brain are sending you. Signs that go far beyond a little forgetfulness. Signs that many people brush off, ignore, or blame on stress. And by the time they finally get checked out, valuable time has already slipped away. So stick with me, because today we are diving deep into something that affects millions of families, something that creeps in so quietly that most people don't even notice until it's already changed everything. And by the end of this video, you are going to know exactly what to watch for in yourself or in someone you love. Now, here's the thing nobody tells you about dementia. It doesn't show up overnight. It doesn't announce itself with a dramatic moment. It builds slowly, subtly, hiding behind excuses like, I'm just tired, or I've always been a little scatterbrained, or it's just part of getting older. And that right there is the trap. Because normal aging and the early stages of dementia can look deceptively similar on the surface, but underneath there are 2 completely different stories. Normal aging might mean you occasionally misplace your keys. Dementia means you find your keys in the refrigerator and have no memory of putting them there. Normal aging might mean you blank on a word once in a while. Dementia means you stop mid-sentence and can't find your way back to what you were even talking about over and over again. The difference is in the pattern, the frequency, and how it affects daily life. And once you understand that difference, you'll never look at these warning signs the same way again. So let's start with warning sign number 1, and this is a big one: memory loss that disrupts daily life. Now I want you to really pay attention to that word, disrupts. We're not talking about forgetting an appointment once. We're talking about forgetting the same conversation you had 5 minutes ago, asking the same question over and over within a short period of time, relying heavily on notes or family members for things you used to handle on your own without a second thought. This is memory loss that gets in the way of living. Someone might forget important dates, forget events that just happened, and increasingly need to lean on others for things that used to be second nature. And here's what makes this so tricky. The person experiencing it often doesn't realize how often it's happening. That's part of what makes this condition so sneaky. It's usually the people around them, the spouse, the adult children, the close friends, who start to notice the pattern first. Now, let's talk about warning sign number 2, and this one surprises a lot of people. Challenges in planning or solving problems. This isn't about being bad at math. This is about a noticeable change in someone's ability to develop and follow a plan, to work with numbers, to follow a familiar recipe, or to keep track of monthly bills. Maybe they used to balance their checkbook without breaking a sweat, and now numbers just seem to swim on the page. Maybe they used to cook a family recipe from memory, a recipe they've made 100 times, and suddenly they're lost halfway through, forgetting steps or ingredients they've used their whole life. It might take them much longer to do things than it did before, and they may have trouble concentrating. This kind of change isn't just frustrating for them. It's often the first real sign that something deeper is going on beneath the surface. Here's warning sign number 3, and this is one that families often mistake for simple clumsiness or just being old-fashioned with technology, difficulty completing familiar tasks. I'm talking about tasks that used to be second nature: driving to a familiar location, managing a budget at work, remembering the rules of a favorite game, or even preparing a meal they've made 1,000 times. When someone starts struggling with tasks that were once automatic, tasks so ingrained they never even had to think about them, that's a signal worth paying close attention to. It's not about learning something brand new and struggling with it. Everyone struggles with new things. This is about losing the ability to do something that was already deeply familiar, something that used to be as easy as breathing. And let's talk about warning sign number 4 before we wrap up this first part of our journey together. Confusion with time or place. This is a profound one, and it's often deeply unsettling for families to witness. This can look like losing track of dates, seasons, and the passage of time. It can mean someone forgets where they are or how they got there. Someone might struggle to understand something if it isn't happening immediately in the here and now. Think about a person who suddenly can't remember what season it is, or who becomes disoriented in a neighborhood they've lived in for decades, a place that should feel as familiar as the back of their hand. This isn't about occasionally losing track of what day of the week it is. We've all done that. This is a persistent, recurring confusion about time and place that doesn't resolve itself with a quick reminder. Now, these first 4 signs are just the beginning. There are 3 more warning signs I need to share with you. Signs that are just as important, and honestly, some people find them even more surprising than the ones we just covered. But before we move forward, I want you to pause and really reflect on what we've discussed so far. Think about yourself, think about your parents, think about your spouse, because awareness is the first step toward catching this early, and catching it early can make all the difference in the world. Welcome back, And thank you for sticking with me. If you're just joining us, we've already covered 4 critical warning signs: memory loss that disrupts daily life, trouble planning and solving problems, difficulty with familiar tasks, and confusion with time or place. Now we're going to dig into the next 3, and I promise you, some of these are going to catch you off guard because they don't look anything like what most people picture when they hear the word dementia. Let's move into warning sign number 5, trouble understanding visual images and spatial relationships. Now, this one is fascinating and often overlooked because most people associate dementia purely with memory, but for some individuals, vision-related problems become one of the very first noticeable signs. This can mean having difficulty reading, judging distance, or determining color or contrast. Imagine someone who has driven the same roads for 40 years suddenly struggling to judge how far away another car is. Or someone who used to read the newspaper every morning, now finding the words seem to blur together or float off the page in a way that has nothing to do with needing new glasses. This isn't a vision problem in the traditional sense. This is the brain struggling to process what the eyes are actually seeing. It can also show up in something as simple as looking in a mirror. Some individuals may actually think there is someone else in the room, not immediately recognizing their own reflection, which, as you can imagine, is deeply distressing for both the individual and the people who love them. This sign often gets dismissed for months, sometimes years, because everyone assumes it's just an eye problem when really it's the brain's way of waving a red flag. Now let's talk about warning sign number 6, and this is one that I really want you to sit with because it affects something we all rely on dozens of times a day without even thinking about it: new problems with words and speaking or writing. This is when a person may have trouble following or joining a conversation. They might stop in the middle of a sentence and have no idea how to continue, and unlike the normal occasional word mix-up we all experience, they may struggle with vocabulary, having trouble finding the right word, or calling things by the wrong name entirely. Picture someone calling a wristwatch a hand clock, not as a joke, but because in that moment the correct word has simply vanished from their mind, replaced by whatever description their brain could piece together instead. This is fundamentally different from the tip of the tongue feeling we all get sometimes. This is a persistent, growing struggle with language itself, the very tool we use to connect with one another, to tell our stories, to express our needs. And when that tool starts to fail someone, it doesn't just affect communication, it affects their confidence, their independence, and often leads to withdrawal from conversations they once would have jumped into without hesitation. And now, warning sign number 7, and I want you to really absorb this one, because it's often the sign that finally makes families realize something serious is happening: decreased or poor judgment. This might show up as changes in the way someone handles money, perhaps giving away large sums to telemarketers or strangers in ways that are completely out of character for them, or paying far less attention to grooming and personal hygiene than they used to. Someone who is always meticulous about their appearance, always put together, always careful with their finances, may suddenly start making decisions that seem completely unlike them. This isn't about someone making an occasional bad decision. We all do that from time to time. This is a consistent pattern of poor judgment that represents a real departure from who that person has always been. And here's what makes this sign particularly heartbreaking. Often the individual experiencing it has no idea their judgment has changed. They feel completely normal to themselves. It's the people around them, watching a lifetime of careful decision making unravel, who feel the full weight of what's happening. So now you have all 7 signs: memory loss that disrupts daily life, challenges in planning and solving problems, difficulty completing familiar tasks, confusion with time or place, trouble with visual images and spatial relationships, new problems with words and speaking or writing, and decreased or poor judgment. Individually, any one of these might not mean much. We all have off days. We all forget things. We all misplace our keys or blank on a word now and then. But when you start to see a pattern, when several of these signs show up together and persist over time, that is when it's time to pay attention. And more importantly, that is when it's time to talk to a doctor. I know this can feel overwhelming. I know that watching someone you love change in these ways, or noticing these changes in yourself, can bring up fear, denial, even grief for the person you remember them being. But here's what I want you to hold on to. Awareness is not something to be afraid of. Awareness is power. The earlier these signs are recognized, the earlier a proper evaluation can happen. And the earlier a person can get connected with the right support, the right resources, and in some cases, treatments that can help manage symptoms and improve quality of life for longer. All right, let's pick up right where we left off, because now we're moving into territory that I think is even more important than recognizing the signs themselves, and that is what you actually do once you've noticed them. Because here's the truth: recognizing a warning sign and then doing nothing about it out of fear or denial, that helps no one. So let's talk about the real practical steps you can take starting today. The first thing I want to address is something that stops so many families in their tracks before they even begin, and that is the fear of the conversation itself. How do you sit down with a parent, a spouse, a sibling, someone you love deeply, and tell them you've noticed changes that concern you. This is one of the hardest conversations a person can have, and I want to be honest with you, there is no perfect script that makes it painless. But there are ways to approach it that make it easier, more compassionate, and far more productive than simply blurting out your fears in a moment of frustration. The key is to come from a place of love, not accusation. Instead of saying you're forgetting everything or something is wrong with you, which immediately puts a person on the defensive, try leading with specific, gentle observations. Something like, I noticed you seemed a little confused about what day it was last week, and I just want to make sure everything's okay. Would you be willing to see the doctor together, just for a checkup? Notice how that frames it as care and partnership, not judgment. Most people, when they feel loved and supported rather than criticized, are far more open to taking that next step. Now, here's something crucial I want you to understand, and this might actually bring you some relief. Not every case of memory trouble or confusion means dementia. There are actually several conditions that can mimic these symptoms almost perfectly, things like vitamin B12 deficiency, thyroid problems, urinary tract infections in older adults, which can cause surprisingly dramatic confusion, medication interactions, depression, and even severe stress or lack of sleep. This is exactly why a proper medical evaluation is so essential, because some of these mimicking conditions are completely treatable, and once treated, the confusion or memory issues can improve dramatically or even resolve entirely. So please don't let fear keep you or your loved one from getting checked out. Sometimes what looks terrifying on the surface turns out to have a straightforward, manageable explanation underneath it. So what does that evaluation actually look like? Typically, it starts with a visit to a primary care doctor who will often begin with a thorough conversation about symptoms, medical history, and any medications currently being taken. From there, they may perform cognitive screening tests, simple exercises that assess memory, problem solving, language, and attention. These aren't scary or invasive. They're often just short sets of questions and tasks. Things like recalling a short list of words after a few minutes, drawing a clock face, or counting backward from a number. Depending on the results, a doctor may order blood work to rule out those treatable mimicking conditions I just mentioned, and in some cases, they'll refer the patient to a neurologist or a specialist in cognitive health for more detailed testing, which might include brain imaging like an MRI or CT scan. This entire process is designed to build a complete picture, not just of what's happening, but of why it's happening, because the why often determines what happens next. I also want to talk about something that doesn't get discussed enough, and that is the emotional weight this journey places on caregivers and family members. If you are the person who has noticed these signs in someone you love, you are likely carrying an enormous amount of worry and possibly guilt, fear, and even anticipatory grief. I want you to know that these feelings are completely valid and you are not alone in experiencing them. Caregiving, even in these very early stages before an official diagnosis, is emotionally demanding work. This is why building a support system early matters so much, whether that's other family members sharing the responsibility, support groups specifically for caregivers, or simply a trusted friend you can talk to honestly. You cannot pour from an empty cup, and taking care of your own mental and emotional health isn't selfish. It's absolutely necessary if you want to be able to show up for your loved one over the long haul. Let's also talk about lifestyle factors, because while there is no guaranteed way to prevent dementia, research consistently points to certain habits that support brain health and may help reduce risk or slow progression. Regular physical exercise increases blood flow to the brain and has been linked to better cognitive outcomes. A heart-healthy diet rich in vegetables, fruits, whole grains, and healthy fats while limiting processed foods and excess sugar supports overall brain functions. What's good for your heart tends to be good for your brain too. Staying socially engaged, maintaining friendships, having regular conversations, participating in community activities helps keep the brain active and can help stave off the isolation that often accompanies cognitive decline. Mental stimulation matters as well, learning new skills, doing puzzles, reading, playing music, anything that challenges the brain in new ways. And of course, quality sleep and stress management play a bigger role than most people realize, since chronic stress and poor sleep have both been linked to cognitive decline over time. Now, if a diagnosis does come back confirming dementia or a specific type like Alzheimer's disease, I know that can feel like the floor dropping out from under you, but I want to gently remind you of something important. A diagnosis is not the end of the story. It's the beginning of a new chapter, one where you finally have clarity, a name for what's happening, and access to resources, treatments, and support systems designed specifically to help. There are medications available that can help manage symptoms for certain types of dementia, and there are entire care planning frameworks designed to help families navigate legal, financial, and medical decisions well in advance, while the person can still meaningfully participate in those decisions themselves. That's actually one of the most important gifts early detection gives you: time. Time to plan to have important conversations, time to make sure wishes are known and respected. and time to make the most of the good days ahead. Let's bring this all together now, because everything we've talked about, the 7 warning signs, the conversations, the evaluations, the lifestyle habits, all of it points toward one central truth I want you to carry with you long after this video ends. Knowledge is not meant to frighten you. Knowledge is meant to prepare you. And there is a profound difference between those two things. Fear keeps people frozen. Fear is what makes someone notice a loved one repeating the same question 5 times in an hour and then quietly decide not to mention it, hoping it will just go away on its own. Fear is what makes an adult child brush off their own forgetfulness with a nervous laugh instead of picking up the phone to schedule an appointment. Fear whispers that if you don't look directly at the problem, somehow it isn't really there. But preparation is something entirely different. Preparation says, I see what's happening, I don't have all the answers yet, but I am going to take the next right step anyway. Preparation is what allows families to move from a place of helplessness into a place of action, and that shift, that one shift in mindset, is often the single most powerful thing that determines how the rest of this journey unfolds. I want you to think back to those 7 signs one more time, not to memorize them like a checklist, but to really let them settle into how you view the people you love. Memory loss that disrupts daily life. Difficulty planning or solving problems, struggling with familiar once automatic tasks, confusion about time or place, trouble with visual images and spatial relationships, new and persistent problems, finding words, and decreased or uncharacteristic judgment. These aren't meant to turn you into someone who panics over every misplaced set of keys or every senior moment. That's not the goal here, and I don't want you walking away from this feeling like you have to scrutinize every small mistake your loved ones make. The goal is pattern recognition. It's understanding the difference between an occasional slip and a consistent, progressive shift in how someone is functioning in their daily life. That distinction is everything. I also want to speak directly to anyone watching this who is worried about themselves, not just a parent or a spouse, but themselves. Maybe you've noticed some of these signs creeping into your own life, and that fear has been sitting quietly in the back of your mind for weeks or months, maybe even longer. I want you to know that noticing these things about yourself and having the courage to seek an evaluation is one of the bravest things a person can do. It is so much easier to look away, to tell yourself it's just stress, just aging, just a bad week. But choosing to face it, choosing to walk into a doctor's office and say, I want to understand what's happening in my own mind, that takes real courage. And whatever the outcome of that evaluation is, you will be in a far stronger position having faced it directly than you ever would have been by avoiding it. For the caregivers watching this, and I know so many of you are caregivers, whether that role has already begun or you sense it may be coming, I want to leave you with this. You do not have to have this entire journey figured out today. Nobody does. This isn't a road you walk once and it's over. It's a long path with many stages, many decisions, many adjustments along the way. Give yourself grace. Give your loved one grace. There will be difficult days, days filled with frustration, sadness, and moments where you feel like you're grieving someone who is still right there in front of you. That grief is real and it has a name, anticipatory grief, and you are allowed to feel it without guilt. But there will also be good days, meaningful days, moments of connection, laughter, and love that remain fully intact even as other things change. Don't let fear of the hard days steal the good ones from you before they even arrive. If there is one final piece of advice I want to leave you with today, it's this: do not wait. If something in this video resonated with you, if you found yourself nodding along thinking, that sounds exactly like what I've been noticing, please don't let the thought fade away once this video ends. Write it down. Talk to someone you trust about it today, not next month, not when things settle down, today. Schedule that doctor's appointment. Start that conversation with your loved one, even if it feels awkward or uncertain. Early action, even small early action, creates more options, more time, and more peace of mind than waiting ever will. Dementia is one of the most feared diagnoses in modern medicine. I understand why. It touches memory, identity, independence, all the things we hold most precious about who we are as people. But fear should never be the reason we avoid looking closely at the people we love or at ourselves. Awareness paired with compassion and timely action is one of the most powerful tools we have. It doesn't erase the difficulty of this journey, but it absolutely changes how that journey is walked with more support, more understanding, and more time to make the moments that matter most truly count. Thank you so much for spending this time with me today. If this information helped you see something more clearly, whether about someone you love or about yourself, please share it with someone else who needs to hear it too. Awareness spreads best when we pass it forward. Take care of yourselves, take care of each other, and I'll see you in the next one.